Hi, I'm Dr. Martina Bezdickova, and you're about to view a short video about your baby from the doctors here at Washingtonville Pediatrics. Let's start with a look how your 2-month-old is developing from our friends at Simply Parenting.
Sometime between 6 and 8 weeks, something magical occurs between you and your baby. Child development experts call it the social smile. Nothing is more rewarding to a parent after all those months of hard work and little sleep. Smile right back and your baby's sure to do it more. But although smiling and imitating facial expressions is one form of communication, you've no doubt also learned to interpret your baby's other form of communication, crying. Babies cry when they're hungry, in pain, or just plain bored, and this early form of communication is sure to bring you right to your baby's side. But by 2 months of age, as your baby develops socially, he or she will learn to express feelings in other ways.
Are we talking?
Between 2 and 3 months, you will begin to hear babbling and cooing. Listen as your baby tries to imitate and react to your voice and enjoy this early form of communication. This is all evidence of your infant's giant leap in social development. Your baby is sharing and reacting. 2-month-olds also love to explore on their own. You'll find that your baby likes to stare at things, mobiles, mirrors, the world outside, and especially his or her hands. Although 2-month-old babies can't yet reach for a rattle, they can grip it tightly if placed in their hands. Your baby's muscles are developing rapidly. You'll start to notice increasing neck strength, although he or she will still be wobbly for another month or so. Practice standing if the baby seems comfortable in that position, but know that very few babies can support their own weight at this age. Still, varying the baby's position is a good way to counteract the flat head that babies can get from sleeping on their backs. One solution is to put your baby on his or her tummy for short periods, but never for sleep. Most importantly, remember that each child develops at a different pace. Try not to compare your child with others, and enjoy every new step your baby takes.
If you're breastfeeding on modified demand schedule, you need at least 2 hours between feedings for milk to redevelop for another full feeding. And remember, a full feeding is nursing at both breasts. If your baby feeds mostly every 3 hours, but every once in a while needs to feed at 2 hours, it's okay. But every hour is usually too soon. If you're feeding with formula, you can use the 1 hour for every ounce rule. So, if your baby takes 3 ounces of formula, the next feeding should be in about 3 hours. Whether you're breastfeeding or formula feeding, your baby needs iron for normal brain development. Breastfed babies do not require extra iron, but all formula should still be iron fortified throughout the first year of life. You can do a combination of breastfeeding and bottle feeding with breast milk or formula without confusing your baby. And if you are returning to work, our staff will be glad to offer you advice on continuing breastfeeding. The American Academy of Pediatrics strongly advises waiting until 4 to 6 months to begin solid feeding because of the immature digestive tract and the possibility that immature swallowing can lead to choking. There is no health or medical reason to start feeding a baby solid foods sooner than 4 to 6 months of age. If you have a specific concern about feeding your baby, please speak to the doctor during your visit. Several wet diapers a day is still a good sign of adequate feeding, but it is normal for a baby to start having less frequent bowel movements now as they digest more of their feedings. If your baby is having a difficult time passing hard stools, or if your baby does not have a stool for over 48 hours or a wet diaper in 8 hours, please call our office. By 2 months of age, most babies should have a 6-hour period during the night when he or she sleeps without awakening for a feeding. And although you might still hear this, it's a myth that solid food will help a baby sleep through the night. In fact, just the opposite can happen because of immature digestion. Remember, babies still need to sleep on their backs and should be put in the crib sleepy, but not asleep. Try to avoid rocking and feeding a baby until they fall asleep, because this will need to be repeated every time the baby goes to sleep. It's best if they learn how to fall asleep on their own, using self-soothing techniques such as sucking on hands or fingers. Now, let's review some safety tips.
Follow these tips to keep your baby safe and sound. Babies have very sensitive skin and can burn easily. Keep cigarettes and hot beverages far away from your child. Lower the thermostat of your household water heater to 120 degrees to prevent scalding. Keep your baby out of the sun. And make sure your smoke detectors are in good working order. Although it's tempting to dress our babies up with jewelry, these baubles can also be a safety risk. Pierced ears can lead to infection, and necklaces, earrings, and bracelets are a choking hazard. As always, never smoke or drink hot beverages while holding the baby. Remember, safety first, convenience second.
Hi, my name is Kimberly, and I'm one of the nurses here at Washingtonville Pediatrics. Here are some reasons to call our office. If your baby has a fever, a rectal temperature of 100.5 or greater, if your baby is refusing to feed, if your baby is unusually fussy or irritable, if your baby is vomiting, which is more forceful than spit up, and most importantly, whenever you are worried.
Let's end with having fun with your 2-month-old.
Two-month-olds love visual stimulation. Have fun with your baby by making silly faces and placing toys with interesting patterns and colors in their environment. Babies at this age are most fascinated with the human face, especially the eyes. They respond to pictures of big faces, but are most interested in real human faces. By this age, they should be able to mimic your expressions. Give it a try. Hold the baby up to your face and stick your tongue out or make an O with your mouth. Watch your baby do the same. Be sure to change the scenery by taking your baby for walks and placing him or her in different rooms. Your baby's eyes will widen, and you may even get rewarded with a new trick, a smile. Babies this age love to hear your voice. It doesn't matter what you are saying, just talking to your child is helpful for your 2-month-old's development. In a few months, he or she will be babbling back, and maybe even trying to echo your sounds. Another great thing about babies of this age is their love of music. From soothing lullabies to rock, babies react to the notes as well as the rhythm.
Thanks for watching. We'll see you again when your baby is 4 months old.